Hi, Dr. Tracy Tyson. I'm a board certified general pediatrician, and here are 4 things that I would tell you parenting a child with ADHD if I wasn't afraid to hurt your feelings. Number 1, there is no amount of screen time for a child with ADHD that is safe or helpful. It is really challenging for them. They get instant dopamine. They get addicted much quicker than the average child. It makes their attention spans worse. It makes their defiance worse. Everything is worse when they have screens. It is also really hard to regulate how much. So keeping them in the guidelines causes so much more arguing and defiance at home that parents end up giving in and letting them have way more than the recommended amount, which is worse for their ADHD. If you have a young child and you suspect ADHD or you have ADHD in your family, never start them. If you've already gone that way, rip the Band-Aid off and get rid of them. I know this is hard. It is really, really hard, but it will only take a few days and your child will feel so much better and you will want to never go back to them. Number 2, you need to run your household like a school. I know it's really difficult, especially if you are yourself have ADHD, but children with ADHD do so much better when they have reliable, consistent routines. Their behavior is better, their body and mind are so much more calm, and their development is better. So having specific snack time, specific eating time, specific bedtime routine, lots of structure, and everything is spelled out ahead of time. There's not a lot of last minute things that are happening, and it's really challenging. And again, parenting is 80-20, so 20% of the time we need to have things go off the rails. We're talking about 80% of the time. Third thing is they're not getting enough sleep. Very few children in my clinic with ADHD are getting the recommended amount of sleep, and some studies show that children with ADHD need more sleep than the average child, so we really need to work on their sleep. The fourth thing is parents need more therapy than the kids do. We are the ones who are steering the ship. We are the ones who are setting up the structure and discipline around them, trying to manage our expectations, trying to hold them to expectations. We ourselves are often the ones that are in more need of help for ADHD than our children. I know these are not easy things to do. We all want to help our children. When I'm in the office, the reason I say these are things that I would say if I wasn't afraid to hurt your feelings is that when I have a patient and family in front of me, I'm trying to work within the confines that the family already has. I'm trying not to isolate them. I'm trying not to push them away. So I talk about and we make some small changes. I never want to judge anyone. I never want to make them feel judged. However, if you were to ask me my honest advice based on 20 years of experience and all the evidence we have behind it, these are the recommendations I would make. Follow them if you will, make some small changes if that is easier, but just knowing that this is what we wish we could tell you in the exam room, but we never want to hurt your feelings. Take care.